My name is Haya Haitham Shakir from D2. I will talk about TMJ disorder. Management of TMJ. Surgical treatment not involved. Surgical treatment is optional. Osteoarthritis is primary disorder of removable joints characterized with abrasion of articular cartilage and formation of a new bone at the joint surface. A clinical fracture is a pain, usually dull ashing, and maybe have sharp components and movement. Joint stiffness, a limitation in the mouth opening, increasing sensitivity to cold and damp, and maybe reflight with the rest, and non-steroidal drugs. Radiograph findings. Evidence of erosion of condyle on the radiograph occur average at 6 months after the onset of TMJ pain. Density is increased, can found cyst, development of lipping show-like extension on interior border. Management can elimination of the cause include occlusal adjustment or replacement of missing tooth and treatment of caries and periodontal disease. Analgesics and anti-inflammatory drugs, non-steroidal non-steroidal anti-inflammatory drugs, and physiotherapy like heat therapy, muscles exercise, and injection of local anesthesia in TMJ. Inflammatory disorder of TMJ. Rheumatoid arthritis. It's inflammatory disease primary affecting peer articular tissue and secondary on bone. Radiograph findings. The joint space may be reduced, and there is flattening of head of condyle, erosion on condyle, bone destruction occur on the articular eminence, and in advanced stage, erosion of interior and posterior condyle surface, and attachment with the synovial lining. Supportive treatment, rest of joint, soft diet, non-steroidal anti-inflammatory drugs, surgical synovectomy, and removal of synovial membranes. Local treatment done with the heat, jaw exercise with the mouth stretch. It's also called hepatic arthritis. It's maybe acute or chronic, caused by direct spread of organisms like staphylococci, streptococci, pneumococci, gonionococci from infected mouth process, tympanic cavity, or valve blood. Management is management by rest of joint and elimination of movement, liquid diet, and antibiotics and analgesics. Disorder dislocation. Its result when condyle is forcefully displaced anteriorly by failure of muscular co-retention out of the articular fossa, but remains within the capsule of joint. Type of traumatic disorder TMJ: anterior, posterior, and central, medial, and lateral. Anterior is more common than others too, Posterior are rare and result from severe injury. Central, some as the posterior dislocation, middle or lateral occur due to injury to the neck of condyle. With the fracture, it is very rare. Management. Reduction of dislocation, it can be done by the following: with local anesthesia, injection local anesthesia, lidocaine hydrochloride after 1 minute, spontaneous reduction. Under general anesthesia, if above method fails and the patient unduly apprehensive, then this method is used. Post-operatively, the jaw should be immobilized for 10 to 15 days. This helps the inflammation and the edema to subside. My name is Haya Haitham Shakir from D2. I will